Good afternoon. This is Dr. Larry Kidd again, coming to you on Facebook Live. Thank you for tuning in today. And we're here once again to answer your questions, provide updates on events happening related to COVID-19 here at the hospital. So once again, thank you for joining. Also joining me today is Marlee Lauffer. And Marlee is our Henry Mayo Newhall Foundation president for the foundation, and she is also vice president for marketing and communications here at the hospital. So thank you, Marlee, for joining us today.
Well, thank you, Larry. I'm happy to be here and happy that we're providing this service to the community.
Oh, very good. So just a couple of highlights at the hospital before we get started with Marlee, who will provide us with updates and how you can become involved with the foundation, etc. You probably saw last week in the news media, we had a patient that was discharged from the hospital that had been here for some time, had been diagnosed with COVID-19, had a good progress in his recovery to the point that he was able to rejoin his family. Fortunately, we've continued to see that repeated. We've had a number of patients since that time who have recovered, improved to the point, and they've been discharged from the hospital. So we're very excited about the phenomenal job our team has done here at the hospital. And of course, those patients have improved to the point that they can resume a lot of their normal activities in their home setting. So Marlee will share with us a little bit about the foundation and answer some questions that have come in over time related to how you can become involved with our hospital in support of what's happening here.
Great.
Marlee.
Thank you, Larry. So I think as everyone knows, Henry Mayo Newhall Hospital is a not-for-profit independent hospital. And really a lot of our growth over the years in the various services that we provided have come from philanthropy. And we've been very fortunate in the Santa Cruz Valley to have some great community people who have stepped up and done such things as the Roberta G. Vilos Cardiac Cath Lab or the Kim and Stephen Ullman Neonatal Intensive Care Unit. Just two, for example. And every time we have a campaign, the community steps up and participates with us. And it's greatly appreciated because we are the community hospital. So right now, during this particular crisis, we are again seeing the community be very, very generous. And it's a little bit of everything, from groups at home sewing masks, cloth masks that they're donating to the hospital, to small businesses that have found N95s or gloves or booties or gowns or things that they think we could use, the personal protective equipment. They've been donating it like crazy, and we greatly appreciate it. We also are seeing a lot of people in the community step forward with meals, and that's really been, I think, very heartening to the staff. Our COVID units are unable to leave the units during their work shift because they're all gowned up. It's obviously an area of isolation. And so we managed to get people that will provide meals. They'll call the foundation, tell us how much they're able to spend, or maybe they'll have a restaurant they're working with, and they will pull up to the hospital, drop off food, and we can bring it into the COVID units, intensive care unit, emergency room. We're also trying to feed our housekeepers and engineering and central supply, because all of those people make the hospital go round. So we've been really heartened by the community support from restaurants to individuals to businesses, etc. If anyone is interested in donating either PPE or meals, they can contact the foundation at 661-200-1200 or through our website, henrymayogiving.com. The other thing that we've been very, very pleased with is the level of financial support that the community has given. Our website is open 24 hours a day, and we'd love for people to consider making a financial contribution to our not-for-profit hospital, and that helps the hospital with all of the efforts that we have going on right now.
Yes, and again, the staff here are just really so appreciative when individuals from our community donate food, water, we received just a number of very generous donations. As a result of that, individuals have an opportunity to take a break, have a meal, and to just step away from some very intensive work that's underway here at the hospital. And there, as I mentioned previously, it takes a village to take care of a patient here. So there are so many departments involved to support the care of a patient. So we really, really appreciate your support out there in the community for our hospital. We continue to have a few questions about PPE, personal PPE. What should individuals wear when they're out in the community? One question was whether or not it was okay to reuse gloves, for example, after they've been aired out. So if you were to use gloves at the supermarket to collect the items you're going to purchase, that sort of thing. And also, is it okay to reuse masks? So again, the key to preventing contracting the COVID-19 virus really is all about practicing the social distancing that we keep mentioning. Also, frequent hand washing. The quality of hand washing is important. You really want to wash your hands thoroughly and completely, all sides of your hands. And also, last but not least, is just continuing to practice that social distancing that we talk about so frequently, and avoid touching your face, of course, which is difficult, but just remembering that once you have touched a surface, touch your face, the possibility that you could contract the virus increases because your eyes, nose, and mouth is where primarily the virus would enter. So with that, the use of a mask is certainly something that you can reuse from time to time as you go out into public. But should that mask become contaminated via it gets wet or it's soiled, you do want to don a different mask. You want to discard that mask and get a replacement mask to ensure that you have a clean mask at all times that you are carrying. So just to back to Marlee, what are some of the resources that the community is provided by the hospital, by the foundation? We know that there's a lot of community benefit that we provide. Some of it's free of charge, and we want folks to know about that.
Absolutely. I talked a little bit about how the community supports us, but obviously we try to support the community as well. And so I want to remind people that if they go on our website, henrymayo.com, there is a treasure full of information on coronavirus, frequently asked questions, different materials from other organizations that we keep there, as well as information on a lot of other health-related issues. We also, in this time of social distancing, as Larry mentioned, we're looking at how we can provide more online information and programming and classes to the community. So if you look at our community education area, we have classes that we're offering on everything from pneumonia to nutrition, foot and ankle issues or back and neck issues, living with diabetes, both type 1 and type 2, COPD, heart disease, and then mindfulness, because we're all a little anxious right now.
Yes.
So there's a lot of resources that you can find that the community can take advantage of on our Henry Mayo website. So we really encourage people to do that. We also encourage you, and you've heard us say before, that if you are feeling ill of any kind, feel free to come to our emergency room. We have made great efforts to make sure it's a safe environment, and we absolutely want you in the emergency room rather than being at home with an illness.
Most definitely. So do, again, remember that those acute things that would normally come up that you come to the emergency room for, you still should be visiting our hospital for that purpose. And we are quite prepared in terms of ensuring that you're safe, the public is safe that comes to our emergency department or any service in the hospital, as well as our employees. Speaking of which, we know that there are a number of you that have probably postponed some elective kinds of surgeries, that there are diagnostic tests that you may have deferred because for whatever reason your primary care provider has recommended that you defer that for a while. Do be aware that the hospital is starting to prepare and gear up for those things that we haven't been doing routinely at the hospital. We will be resuming that in short order. So look for the details and communication that's going to be coming out around that. With that, we're coming close to the end of our time today, and we'd like to thank Marlee for joining us. Any final thoughts you'd like to share with the viewers today, Marlee?
Well, just kind of a very positive thing about our community. Not only are they very giving to our hospital, to other community organizations, but giving of themselves. And it just kind of struck me that we're doing, I believe, our third blood drive since we entered this pandemic. All of our blood drives have been fully subscribed. So we have one on Friday. I don't think there's any appointments left. There may be one or two you could check online, but again, it just shows that the community is very, very supportive of everybody.
Right, and we so appreciate that. As in regards to that blood drive, again, we've communicated that before. As Marlee said, we filled up the slots, but do keep in mind if you were to contact our site and can't get an appointment, remember there's a shortage across the country for blood. So there are a number of sites that you'll be able to also go to where they haven't filled their slots, and that would be most appreciated for the community at large. So again, thank you so much for tuning in to us here on Facebook Live at Henry Mayo Newhall Hospital, and we look forward to being of service to you, and we hope that you stay safe out there, and we'll see you again soon.